welcome to another episode of the Seamless Connection podcast. Today, I'm thrilled to have with me Matt Runyan, who is spent the last 2 decades at Mount Sinai South Nassau, specializing in healthcare IT, healthcare information technology operations, infrastructure, service management, and basically making sure things are connected and where they need to be when they need to be. So, Matt, pleasure to have you on the show with us.
Thank you very much. It's a pleasure being here.
I know you spent, a big chunk of your career in healthcare, but actually before that, I heard that you were in the U.S. Army. Can you tell us a little bit about your time in the Army and then how you transitioned to healthcare?
Sure. It was a great time, great learning experience. I was in the United States Army. I was in the 82nd Airborne Division, so I used to jump out of airplanes.
Oh, wow.
I
How many jumps do you have?
I have 40 jumps on my manifest, and one of the big things that I learned in the military was really about communication. Communication is the most important thing from a military perspective. I served in Desert Storm and Desert Shield. So during it was deployed in Iraq for 6.5 months. Learn to appreciate the little things in life, such as a tree or even a cloud, because for most of 6 months there was no trees and no clouds, and even just running water. So some of those little things, and I think that's really helped me in the crisis management piece of when everything, like during COVID, when everything is going on and you have to move and make decisions quickly, to stay calm and to realize it really could be worse.
Yeah, no, I mean, I can imagine a number of scenarios where it could be worse. You've probably seen worse, firsthand. In your time in the Army, how did you work in the IT department, or did you work in is that how you got introduced to your future career in healthcare, which was more on that side of things, on technology, on operations, on that kind of stuff?
Well, I was actually a combat engineer, which you learn to build bridges or blow things up. But for the most part, I worked actually in the legal office, the JAG office for the 82nd Airborne Division, to where we were using computers, and they kind of fascinated me. You got a touch of it in college, but I was in college, during the time where there was no ATM machine. So you had to make sure you had money on you. So the military really had my first interest in computers. And I'll never forget, what really interested me was a couple of the attorneys in the office wanted to print something, and there was one printer. And so back then you had to hook up, a parallel cable and a very long parallel cable. And we found a hub, we hooked it up, and everybody could print to a single printer. And it was kind of right there. It was like, yeah, this is something that interests me, and then I started out on the help desk for a major electronics firm, and started helping people, from a call center perspective, and realized that, what, I should run this whole thing, and if I ever get the opportunity to run it, I'm always going to remember who the customer is, and how to help them, and put it in terms of how they want it support, not how I need to collect it. And then I got into healthcare. I got a great opportunity to become a help desk manager in a healthcare setting, and just loved it. Really kind of learned how the hospital works from a workflow perspective, like from the ED and the integration engines and the different applications. And I kind of wrote my own little, I guess, video that I used to teach the help desk and the rest of IT of, it's not just a server that's down, right? Or you just can't print to that printer. What that actually means, in a what I call a cubed environment, like an office environment, you can just switch whatever printer you need to go to. Maybe a little extra walk, but you can do that. In a healthcare environment, teaching that label printer, that's the only one. You can't go 2 floors down and try to find a label printer to print something out, or a printer on the floor. Uh, they've got to work, and so teaching that importance of what happens when it doesn't work, that you have to handwrite things, that it doesn't necessarily integrate and go into the EMR, and if that application's down, and it really was, a great thing for people who first come into healthcare to really understand what that means, because a lot of people don't always start in healthcare; they come from a different industry.
No, exactly. And it sounds like from your time in the military, when you were troubleshooting that printer in high demand all the way through to where you are today, you've definitely approached it from a place of innovation and focus on operational efficiencies and operational excellence, right? In terms of what's the best way we can do this, not just how do I do it, but what's the best way I can do this. How did you come by that mindset in terms of, a lot of people will try and solve the problem in front of them. And I know for you, throughout your career, you've been looking for how do I solve this problem today, but not just for today, but also for the future.
Some great leaders in the military. Uh, our commanding officer always said, anything is possible, and you can accomplish anything if you put your mind to it and you look at different ways. And a vice president that I had at an electronics company who said the biggest mistake companies make is that when someone comes into management or comes into, even as an analyst, an engineer, doesn't matter what they are, and they ask, why do you do something a certain way? The most common answer is, well, we've always done it that way.
Mm-hmm.
And he said, challenge that. Understand why it's being done that way, and see if it can be changed or it can be modified, or is that the best way to do it? And just a quick story was, I ran the call center for their 800 number, and customer service and customer relations was part of the department. And if someone had a TV that needed to be replaced, it would take 3 days before that TV could get shipped out to the person for them to replace it. And I never understood that. So I asked our customer relations rep, and I said, well, why does it take 3 days to do that? Oh, I don't know. This is how we always did it. And I go, well, how do you actually do it? And so he printed something out, signed it, put it in one of those interoffice envelopes, went to the building next door. I went over next door and I said, what do you do with this? And the lady there said, I don't know. I don't do anything with it. I just readdress it back to who sent it to me. And then he does whatever he needs to do with it. And I was like, so how long is this? For years. Right. And it was like, she thought he needed to send it over. He thought that she needed to log something and send it back to him. And so I said to her, I go, well, if you never get this again, does it affect anything? And she goes, that would be great. It just makes it less things that someone send to me. So he could order it right away the moment he puts it in the system. Yes. And so we turned it from 3 days down to an immediate, swap out and shipping, which made the customer happy, made everybody happy, because there was all this extra work. But it's a great example of, tell people when you go someplace, or if you just want to know why something is, ask, follow it from beginning to end, and a lot of that is where the innovation comes in regards to, there's a better way to do it, so let's do it.
No,
let's do it that way.
That's fantastic. You spent the last, few decades of your career here at Mount Sinai South Nassau, and you've made a lot of impacts. You made a lot of innovations.
To be honest, I spent it at several hospitals.
Okay.
The last 5 years I've been at Mount Sinai.
Fantastic. So what were the other hospitals in the system you've worked at?
Brookdale Hospital, which is part of One Brooklyn Health, Montefiore Hospital, and with Northwell Hospital on Long Island, which at the time was called North Shore LIJ.
Got it. I guess my question more broadly is in thinking about your career and what you're most excited about and proud of as an impact and the innovation that you've done for the system and for your peers in those roles. Is there a moment or a project that truly encapsulates the impact of your work on healthcare, or something that you're really proud of in that impact that you've made?
Yes, and it would be bringing mobility to the clinicians. it was during COVID. When I first started at Mount Sinai, I was there a couple months and COVID happened. And so it was, what are we going to do? Right. Long Island, I'm on Long Island, and the New York area was heavily hit by COVID and even PPE supplies. So at that time, the rooms weren't like, you didn't have COVID floors. You eventually moved into that direction. So you had med surge and you had COVID patients. You had a kind of a mix on every floor. And the demands of PPE were very, there was a shortage of it. So you couldn't just put it on, go in, take it off, go into the next room, so you were don and doffing a lot and utilizing a lot of PPE. So how do we, build in better communications and give the clinicians the capability of seeing into the room and speaking to people in the room without actually having to enter the room. And that's true from a telemetry perspective as well. So we quickly implemented, it's a third-party company that does mobile heartbeat that on 1,000 phones, and we made them share devices so you could badge them out. And it integrated with the EMR, and it integrates with a lot of other applications, one of them being nurse call. And so people in the room could press the nurse call button and communicate with the clinicians outside the room without having to always go into the room. And so this made it very, well, what do you need? And they would go in if they needed something. A lot of time they found that it was just information that the patient wanted. And so in the past, you'd have to go in, don your PPE, go in, answer the question, come out, take it all off, and then go treat the rest of your patients. And you had a lot of the ratio was high, and the hospital was packed, and you surged it to extra rooms. It worked really well from a communication perspective because it also gave the nurse manager and administration the ability, if you wanted to send a broadcast message, it's not the telephone game, right? To where you tell shift one, you provide them information. Then when shift two comes in, the new nurse manager or someone else gives them information. Shift three comes in, they give them information. Now you could broadcast that across all the phones, like a text, like a group text, to where as people check out the phones and sign in, they're all getting the same message. And they're all getting the same information. So if a new policy, which was coming out all the time, or a new procedure that was coming out all the time, you could blast it to the entire hospital and all the clinical staff, including the physicians, at a single time, so everybody had the same information. You weren't printing out, posting on a bulletin board, and go, make sure you go check that new process and procedure. You could just send it out. So it really, it was, while it was a very trying time, I always say that COVID advanced IT so far from a clinical perspective in virtual care, in communication, and utilizing mobility. And now that you have that mobility in all the clinicians' hands, now you could do all kinds of stuff, like what we did with ServiceNow.
What do you do with ServiceNow?
So ServiceNow, when you talk to clinicians, right? And I said at the very beginning that I said, if I ever ran this thing, I would understand what the customer wanted, not what IT wants to collect. And so when you talk to clinicians, the biggest challenge is they don't necessarily want to call the support desk. Understandable, right? What's your name? What's your employee number? Got to validate who you are. What's your problem? Right? And the response is, I'm having a problem printing, or I'm having a problem with this wow, the battery keeps draining, or the drawer is broken. And the person goes through and validates you, and then says, okay, what did you call about? Well, you just told me, right? And so it can be frustrating. Meanwhile, alarms are going off in rooms. You have nurse call going on. So we asked them, how do you want to report your issues? And a lot of times, even with the biomed issues or the wows, they wouldn't report it until they didn't have any left, right? Let me just go grab this one.
Yeah.
So we said, well, you have a mobile phone. The mobile phone, ServiceNow has a mobility Mobile app. The mobile app can use the phone to scan. All the wows, all the equipment, all the biomed devices have barcodes. So when I bring in all that data, model number, serial number, what's on it, is it a powered cart, every piece of information about that's in the database into ServiceNow. So now all the clinician has to do is walk over to the device. If it's not working, press open incident. It's a clinical device, it's a biomed device, or it's a WOW. WOW, is it the cart or the PC? It's the cart. Camera opens up, take a picture of what's broken, click submit, and move on. Now, what that does is that sends a picture of what's wrong, gives all the information, serial number, model, make of the WOW, whether it's all the different manufacturers of WOWs, and the third-party company that services it now has a picture, has a serial number, has who manufactures it, and grabs the part off the shelf, dispatches, and repairs it. So in the past, it was I dispatch, I have to look at it and determine what part I need, and then I go back to my warehouse and I come back the next day or the day after. And you turn one trip and you save multiple trips for
Right.
repairing.
Now you've not only reduced the frustration level of the user by simplifying the reporting process, but you've also made the actual repair and replacement process that much more efficient, which is fantastic.
Yes, and from a informational perspective, the biggest thing is clinicians will open up on an Altair's pump, on a ventilator, on whatever piece of medical equipment that they want to report to biomed. And so we built an integration to the biomed system as well. And so the biggest thing about it was once you send the ticket, how do I know what the status is? A lot of times it was I have to place a phone call, I have to send an email, I have to do all kinds of things to try to get the status. Well, through the ServiceNow mobile app and the service catalog, you can just go in and check the status
of all the applications
of what I just opened the ticket on. And the nurse manager can see all the different ones. And we've integrated Epic to ServiceNow. We're working with another hospital who did a great thing in creating a landing page, because Epic and ServiceNow is incident only. But you have a request and check status. So you create a landing page so you can do all three from within Epic. And so we're building that out to even further give the clinicians the capability of everything that they need, to move forward from a technology perspective.
What I love about this story, though, is that when people think about COVID, and to your point earlier about COVID pushing forward telehealth, pushing forward IT, pushing forward innovative technology adoptions, that all is true. But people forget about the reality on the ground of what happens when your cart breaks, what happens when your camera is broken, what happens when your microphone doesn't work, what happens when things aren't charging, everything that needs to functionally happen consistently for that virtual care workflow or the on-site, on the ground workflow to function smoothly. And it's so refreshing to see the details behind what actually keeps everything moving in a very seamless process.
No, I was always big on developing staff to say, listen to what your customer wants, right? Understand their job, right? And understand what the impact is when they are impacted, and what's impacted is patient care. And so you want to make, they are our true customer. I always kind of have fun with people when they first start in healthcare IT, and I go, who's our customer? And they say, oh, the doctors, the nurses, the administration staff. And I'm like, nope. Our customer is the patient. We provide the technology and tools for our doctors and clinicians to use to provide support and care to our customers. And when those don't work, we can't, it slows down that patient care.
One of the things that I've run into a lot, and you probably have too, is how do you balance the drive for this need for technological innovation with financial and operational realities of hospitals, especially hospitals today. Post COVID, there was a lot of financial hardships. We saw a lot of hospitals, close or have to reduce services. Um, how did you do that? And how did you take that into account running a large healthcare IT department, especially in terms of budget management and cost reduction, when exactly what you're saying, it is so critical to the seamless functioning of serving the patients, the ultimate customer?
So there were really three things that I did. The first one is I looked at my existing tool sets and said, am I using 100% of what they can do? What is it that they can do that we're not utilizing? And then you made a list of all the things that you were licensed for, right, for a particular application. And you said, we're not using these 6 things. So what are we using for these 6 things? Because we're using these 4 or 5 applications to do that. So let's expand here. And let's end the contract with the 4 or 5 other things that we're using. So we simplify our tool set. And then the moment now, since I want to use those 4 or 5 things that I'm licensed for but not using, I took that opportunity to renegotiate the contract. And so I want to add, there's going to be some support on it. So let's renegotiate it. And you know what? It's a tough time. Hospitals are having, and a lot of times if you just ask your vendor that you're working with, right, they will work with you on giving you a better deal. They really will, and they'll be open to renegotiating, because one is ultimately it's business. They want you to stay as a customer. They want you to succeed, because eventually they may use it as a reference or whatever. But they really do understand, and so that was one thing of using, the different tools on it. The second thing was around small logos. Right? Everybody likes to use the big names, and there's a lot of great technology and a lot of great ideas out there. And a lot of times the small logos are people who used to work at the large logos. And so they really understand what you want, and they just want to get in. And so they'll give you a better pricing, and better deals on it, in regards to that. And then the third one was renegotiating contracts, just asking. So say, listen, you guys have been a great partner. What can we do to really make it more financially, beneficial for both of us? I understand you're in business. You need to make money, but we need to have money to be able to pay you, or you're not in business, and then we don't have what we need. So I have found that, especially in healthcare and even outside healthcare, if you always have an honest and open relationship with your vendors, they'll work with you, and to treat them more as your partner than a vendor. And that's kind of how I like to look at things: is we're in this together to provide better patient care.
That is the right approach, I think, in terms of when I've seen different approaches amongst different health systems. What you just highlighted as kind of your kind of key steps is the ones I've seen most successfully implemented for kind of a cohesive, ongoing, scalable program. So
yeah, my mom used to always say, right, it never hurts to ask.
yeah,
The
exactly.
worst thing you're going to hear is no, but you'll
And then
never wonder,
yeah,
right? If you get
exactly.
told the no, okay, you asked, you know the answer, move on, figure something else out.
What do you want? What do you expect or hope to see as the biggest advancement in healthcare, or if you want to focus on healthcare IT as well, over the next 10 years? Because there's lots of talk about AI, generative AI, clinical decision making. There's lots of talk on different tools that are coming out that take advantage of that or otherwise. There's advancements in surgery. There's advancements in clinical delivery and data and analytics. So many areas that you've been exposed to. So I'd love to get your thoughts on what are you most excited about, and what do you think will be the biggest advancement over the next 10 years?
I think it's definitely going to be AI, and I think it's going to be remote surgery from a teaching perspective. So Mount Sinai, if you go to their webpage and you look it up, they have the ability to where, you see it in like the Mission Impossible movies and all the movies. If someone puts on a pair of glasses and I can see different things, right? that exist today. They have the capability to where in small towns or small areas, in third world countries, that you could have a surgeon from the U.S. help participate with a surgeon that's remote, in the sense of they can wear glasses and you can draw on a screen and say, here's where you want to make your incision, and it shows up on the body from what I'm looking at, and you can do things along those. It's a really great video that's out there on that. But AI in general, in both clinical decision, um, right? I'm a father of 7, so I have 2 kids out of college, 3 kids currently in college, and 2 kids, writing papers with Chat GPT. But the um, you know, to where just the catch up time of a conversation. If you join a major incident and you want to know what was done, right now you have the capability of an AI to where it can give you a summary of everything that was done, instead of stopping the call and going, hey, what's happened, right? What's been done yet, and what do we still need to do? Things like that from a clinical perspective. Here are all the things that are in the notes. Instead of reading all the notes, here are the high points of it, of what's been done, so you can catch up faster. I think that is going to be tremendous, and that's what's going to be going across, uh, the future. It'll probably know that I want to have eggs and bacon tomorrow and order it from the local store and have it delivered, right? Um, by just thinking it. So I think AI is a big thing, and I think the use of technology in VR ties into AI is really the future
of how it's going to play out. No, I can definitely see lots of use applications, surgical fields or otherwise, but especially for training, that makes a lot of sense. How do you see yourself playing a role in that? Like, what are you excited to participate in on a personal basis?
creating, thinking out of the box of other uses for it, right? In listening to what people want, and really trying to make that happen. I mean, one of the things that I would loved was you see all these hologram concerts, right? That they do. I think ABBA has one, in England, that and they're not really on stage. It's all holograms. Is that with physicians who could do rounds and be in the room and talking to the patient, but being someplace else, or even if they're on call, because while you can reach a physician on call, and they will call in, and you can do virtual now, right, through the phone or through the TV set, having them almost there, right, and not really there, but where the patient thinks they're there. There's a comfort of talking to someone face to face, almost, in person, so to speak. But that would be something that thinking things like that, of saying,
Yeah,
you know
that's amazing. I'm just my brain's already racing thinking about all of the logistics that go into that, from the the device or whatever that's going to beam that doctor to the power source, to how do they communicate if there's a glitch, or what do you do when a patient freaks out because they're on a psych hold and they see this specter appear in front of them, and like from the clinical to
well,
the
yeah,
tech.
I mean, you better warn them ahead of time, but
Yeah, exactly.
but you all the technology almost already exists in the room, except for maybe the laser or whatever it is that you're going to use it. But all your connectivity, because you're already doing a lot of this stuff from a virtual perspective, with cameras in the room, all kinds of Bluetooth monitoring. I mean, you have a lot of different capabilities that to me it doesn't seem like it's crazy.
Yeah, no, I mean that's super exciting. That's where we're seeing, to your point about having the chip in your brain. I think the first human had their first brain chip implanted, I think last week, with one of the Elon Musk's new inventions. So we'll see where that goes. We might all have one in 10 years. And I want to close
I
with,
might
I always
remember what my wife told me to do if I had
yeah.
one.
I always like to close with asking somebody, my guests, about their healthcare story, because I'm a firm believer that everybody has a healthcare story, something that really motivates them, really drives them, or really brought them into healthcare in the first place, whether it's for you or a family member. Do you have a healthcare story you're willing to share with us today?
Sure, it's kind of funny actually, but you know, when I was at Northwell, I was one of the incident commanders for IT for the overnight during when the hurricane was hitting, Hurricane Sandy, and so I was given a little bit of time in order to uh, go home, kind of tie everything down in the backyard so it wouldn't end up down the street. And it was really buggy. And so I ran in the garage, I sprayed myself with bug spray, ran out there, tied everything up, and then ran back to the hospital to get ready for the storm to hit and get everything prepared. And I was there, and someone said, "Matt, you look terrible. You're like as white as a ghost, and what's wrong?" And I'm like, "I don't know. I ran home. Maybe I haven't eaten. I put bug spray on, and it was really buggy, and maybe it's that." And then I get a phone call, and it's my wife, and she was finishing up kind of what I had started, and saw in the garage that I didn't actually use bug spray. I used a can of Raid wasp killer that I sprayed myself down. It does work, by the way, but I think it poisons you at the same time. So I kind of sat in the corner, drank a lot of water. They kept an eye on me. I was in the right place, right? With everybody around. But yeah, I mean, I'll never forget that. While it does work, it's probably not a good idea. I don't recommend anybody to try that.
Use only as indicated.
That's right.
Got it. Fantastic. Well, Matt, thank you so much for taking the time to join me today and share your thoughts and your experiences and your stories with us. And I'm looking forward to staying in touch and seeing what you are going to be working on in these next 10 years, especially if you do that virtual physician routing. That sounds fantastic with the hologram.
It'd be fun. Thank you, Mina, for your time as well. And love doing this. So if another topic comes up sometime, I'd love to do it again.
Fantastic.